Welcome to Startup Health TV. I'm Logan Plaster. For this holiday episode, we wanted to bring you one of our favorite stories to come out of 2021. It's the story of a creative, perhaps unlikely collaboration between Katherine Grill, the CEO and founder of Neolth, a mental health startup in the Startup Health portfolio, and Saranne Rothberg, the founder of ComedyCures. As you see, their serendipitous meeting at the last Startup Health Festival led to a friendship, which then led to a clinical trial for women with advanced cancer. The results of the trial will come out soon, so we'll watch this space and we'll share that information. But this episode is about the people behind the collaboration and about the out-of-the-box mindset really necessary for an entrepreneur to succeed. It's about understanding that opportunities and relationships may not always come in the form you're expecting. Stick around.
Great.
Welcome to Startup Health TV. Katherine Grill, Saranne Rothberg, pleasure to have you on this episode. I'm excited to hear about what you're building, how you've collaborated together. Before we get into the project that you're doing together, I want to hear about your individual work. So Katherine, let's start with you and your work at Neolth, what you've built and really what the last year has looked like.
Thanks again so much for having me here today. You know, at Neolth, what we've really been focused on is how to increase access to mental health care. As we've seen during the pandemic, really across the country, people have been struggling with their mental health, and there's been such an increase in demand, but it's been making it very difficult to access services. So our kind of question is, well, how do we use technology to make things more accessible, to reduce stigma? And we've built a self-guided mobile application that does just that. We've actually been focused on youth to date, and this collaboration with ComedyCures is really exciting to kind of branch out, working with another population and seeing how, you know, our services work there. So pleasure to be here today and looking forward to talking about our collaboration.
Awesome. Saranne, you're with the ComedyCures Foundation. Just give us an overview of what that is and what you've built there.
Sure. Thanks again, Logan, for having me too. And it's such a pleasure to be here. You know, I'm a huge fan of Startup Health, so I'm just honored to be part of this today. I am the CEO and founder of the ComedyCures Foundation. I'm a stage 4 cancer survivor with no visible disease, and I launched this crazy nonprofit from my chemo chair, my first chemo treatment, April 1999, by throwing a chemo comedy party. And in the middle of that party, which was a celebration of life while I was having chemotherapy, I realized that we had disrupted cancer treatment. That party, that 6 hours of comedy and sparkling drinks and party favors and little sandwiches and desserts really broke down the isolation of that chemo room. And it helped people join something that was bigger than their own pain, their own nausea, their own fear. And so I went home and threw my guts up, and in the middle of that, just saw this vision that I was going to bring therapeutic entertainment into the trenches of treatment. And that's what we've done. We've helped over 1 million people on 4 continents around the world. And we used to do that live. And now, since COVID, we pivoted in March of 2020. And now we do it all digitally. And that's what led me to reaching out to Dr. Grill, was that now we were in this digital age and she was doing exciting things in mental health. And we just thought there was a way that we could help oncology patients.
Well, before we jump into actually how that looks, you know, it's interesting to just think about how these worlds will come together. Dr. Grill working on, you know, mental health, access to care for young people. And Saranne, you're talking about, you know, really using comedy and humor as a cure, as a new way to think about oncology care. I want to know how it all comes together. I understand you both met at the Startup Health Festival. Katherine, why don't you start? How did the two of you come together first? And we can talk about how the collaboration formed afterwards.
Yeah, absolutely. So we did meet at the Startup Health Festival. It would have been 2020, so right before the COVID shutdown. So we had a chance to meet in person, which was fantastic. And Saranne was actually interviewing me for Startup Health TV. And we were talking about the work that I was doing. And I guess a little bit of background on me, before founding this company, I was working as a clinician and not just working with young people in behavioral health, but I was actually also working in palliative care and oncology, which is why I really had an interest in that space. And we got to talking about the different applications of Neolth and what we were doing. We've been working a lot with schools, but I've always had this interest of kind of bringing it into more of the healthcare side and oncology. So we got to talking about that. And of course, had a lot of things to discuss as Saranne has just experience in this as, a patient and as an advocate and now the leader of ComedyCures. So that's really how this whole collaboration was kicked off.
Saranne, what was that experience like for you going from interviewing Katherine about her work to really realizing that this connected to something that you were doing?
Well, first of all, just to give a shout out to the live Startup Health Conference. I know we didn't have it last year, but what a phenomenal experience. I went as an attendee also, in addition to being a host and also a moderator on the big stage. And from all aspects, it was just so rich. So I can't wait till you do it again because I learned so much. I met so many people and I just had a blast. It was just fun to be with so many interesting people doing so many interesting things in healthcare, right? So Katherine was one of the many people that I got to interview, as she said. And just from the interview, I could see her passion, her dedication, her intelligence. And I loved the idea and I really loved the application across the board in healthcare, but really selfishly in oncology, because even though ComedyCures does programs for all ages, all illnesses, all challenges, of course, coming out of surviving stage 4 cancer is really close to my heart. So we bonded over that intersection of mental health, oncology, technology, helping people, disrupting things. And so I actually invited her to go to lunch the next day. And I just wanted to hear more about, how she was going to really grow this. And as a mentor, because that's what I love to do, mentor, I wanted to see if there was any way my skill sets, which are very different from her skill sets, could help the growth and the expansion of her vision. And then eventually there would be a way that we could collaborate together. And so I literally just volunteered my time to help her with what I do really well, which is think about communicating healthcare to other people. How are we going to communicate this project, this message, her skills, her expertise to the world in the most digestible way so that she could get funding, publicity, great board members. And that's what we just kept in touch about.
Katherine, obviously being at a festival like this, it's about, meeting people and you meet investors, potential partners, clients, future employees. What is the role for a founder of really embracing maybe non-traditional collaborations, really keeping your eyes open to what kind of partnerships could exist at an event like this?
Yeah, I think that's a fantastic question because sometimes you might come into it with a founder with a kind of narrow view, like I'm fundraising and I only want to meet investors. Yeah, but I think really as a founder, you need to understand like how your business is going to be evolving and changing over times. And the people I might want to connect with today are not, there's more possibilities beyond that. So I didn't want to keep my focus narrow, only connecting with investors or whatever it was. And I thought it was really interesting, about this collaboration with ComedyCures because, as we said, we've been focusing on working with youth and working with schools. But as a founder, you do want to start to dip your toes into some other areas, so to speak, and really learn about, how can my product maybe be used to help more people and start to expand without needing to take a huge amount of resources to find a collaboration partner or to test your product with a different patient population. So this was really a fabulous opportunity for me as a founder to be able to start to explore other markets in a way that was just, really simple and a lot of fun.
We keep alluding to this collaboration and the work that you did. And so I want Saranne to really kind of break it down what you've done together. But I feel like it's important to, I don't know, remember that as entrepreneurs, we often test the water with the idea of collaborations with folks, and oftentimes it doesn't come to fruition. And so a certain amount of thoughtfulness has to come into saying, you know what, let's really keep our eyes open to how we can really work together, and not just have it be talk, right? Talk at a festival. Hey, we should do something together sometime, but really bring it together and let's do it. Let's find a way to make this actually work. So Saranne, you did that. Tell us how you came upon the opportunity that really made it possible to put this potential for collaboration into action.
I want to address that. I actually want to go back to the conversation that you guys were just having, because I think it makes a really incredible point, and I want to add to it. She got a twofer, okay? And what I mean by that is I have this expertise in collaborations and marketing and healthcare and advocacy, but my husband is a VC. And her project was too early for the stage that he looks for. But because I got to know her and was a huge advocate, they've actually been able to develop a relationship and grow that relationship and that mentorship. And he does represent a funding source. So I have to take my hat off to Katherine, because she saw the value beyond just me. And that's basically this. I give the same advice to somebody who's dating, because I think founders date, right? So I might not be the source that could write the check that day, but I know 5 people or 6 people, and those 6 people could be. So when you're in a situation like the Startup Health Conference, pretty much everyone there is dynamic within their own universe. And through their networking connections, you now have the opportunity to leverage each person you meet there by being open. So what Katherine said was incredibly wise. And one of the things my husband taught me is that there are a lot of ideas. She is not the only mental health care platform, but what VCs look at is the founder and the people around the founder. And Katherine is an unbelievable founder, and she has a network of people around her advising her that are powerhouses. And this is going to sound weird, but I'm older, so I'm going to say it. She's coachable. And that's what VCs look for. They want strong, smart founders who don't think they know it all. And they want people who are coachable. And she just checked all the boxes for somebody that you want to get involved with at whatever stage. So even though my husband funds at a later stage, he has been tracking her progress and her development and what her goals are, and is very impressed with her as a founder. So I just wanted to give that little bit of 2 cents. But just back to your question, which is, how did this happen? Well, first it happened with a desire to work together, right? We both found this intersection that would be interesting to both of our organizations. And then the next thing, you could say it was divine providence, luck, who knows? I happen to have given a keynote and done workshops at the Marriott headquarters years ago. And a woman in my audience at Marriott, when I did programming with ComedyCures for their health day, actually ended up getting cancer and remembering all the lessons and the things that I taught, and started a nonprofit that actually develops programming, does research for advanced patients living with advanced cancer. And so she reached out to me late one night and just said, I would like to give you a grant to explore some research for women living with advanced cancer. Would you like to do that? And I explained to her that I am not a scientist. I work at, I've spoken at the NIH, spoken at Stanford, Harvard, NYU, on and on and on. But just be clear that I am a stage 4 survivor and an advocate, not a doctor, not a researcher. And she said, I know, but I think that you'll think of something incredibly interesting to do with this funding. That would be a preliminary, like, pilot study, feasibility study that could change the conversation, open up a new conversation in cancer. And I had been wanting to work with Katherine, and I just knew that if I went to her, that we would probably think of something that would be really interesting, that would do what the Willow Foundation asked, which was change the conversation in cancer. And so I called Katherine. She was 3 hours behind. And I said, what do you think about this? You know, you've wanted to open up this lane potentially in oncology, and this could just let us all see how this would work out. And so she said, yeah. And then I'll let you take it from here, because she brought in another interesting person, and this is how it started.
Yeah, let's hear about it. Dr. Grill.
Oh, yeah. Well, as Saranne was mentioning, she wanted to do this grant, but had never done a research study before. And there's a whole lot to think about. And I think this is maybe some advice to other companies who are out there listening, especially if you're a founder, but you haven't done a research project. People want to jump in, whole big project and like an RCT or a clinical trial. And I would say, wait, breaks. It's like the scientist in me. You need to first start small. And it's like these stepping stones to build up. But I said, okay, well, I've done a lot of research. I did NIH research. My chief medical officer, Dr. Claire Wheeler, has done a lot of research in her career. We have no problem doing a small study, but I think let's start off with what's called feasibility and satisfaction, and really trying to understand how these programs and digital programs are used by different folks. Because I think what we've been seeing in general, like digital health is a very young field, and there's just still not enough as scientists that we know about who is using this, how they're using it, when they're using this. And I think we can really even break it down into specifics, as Saranne and I are learning through this study. Women with cancer who are maybe stage 4 and who are very sick are going to be using a product very differently than a survivor or somebody who's, stage 1 or stage 2. So it's a little bit about, understanding the patient population that you're working with, and really understanding the specifics of how they use this program, which was why this was, I think, a great research project for us to start to understand that, to get this information and to be able to share it with the wider community. So Dr. Wheeler, Claire Wheeler, is somebody that we brought on to this project as well. She's both a medical doctor and a clinical psychologist, so an MD, PhD. She's written multiple books like Pocket Therapy for Stress, 10 Simple Solutions to Stress. She even, lost her mother. Yeah, there's the book. She unfortunately even lost her mother to cancer, so it's very personal for her. And we wanted to bring her in as well to really make sure that we were giving this project its due, and that we were bringing in scientists, we were bringing in kind of the innovators and the technical team, and then we were bringing in someone like Saranne with the kind of patient advocate experience, and have a really well-rounded study team on this project.
What was so exciting? What was really exciting is that I wrote a press release about this project. And as Katherine said, this is a small pilot project. We did not expect the response in any way, shape, or form from the media. The release generated so much interest, but one of the crowning moments was a chief scientific investigator from one of the most powerful entities in cancer research reached out and said to me, "You've just changed the conversation in cancer research. You have opened up a whole new lane that we were not thinking about. And although this is a small study, all eyes are on this, because this is just a completely new conversation, what you're trying." And we have had so many surprises. The NIH will pay for people and struggle to get 8 to 10 people in a study. We had so many people from around the world reach out to do the eligibility survey. And Katherine just reached out to me. She's like, "We have to cut this off. This is just a tiny
Good problem
study.
to have.
We are just, we just need to, keep the reins on this, because we just really want to understand what we're dealing with." We did not anticipate all the languages and time zones. We didn't anticipate how many older people who had no experience with apps and technology would want to be part of the study, and that we would be describing what an app is and how you download it. So there were so many interesting surprises, but it has been an incredible pleasure.
Yeah. Just for clarity, my assumption here is that the feasibility study is really around deploying the Neolth platform, the app, with you said stage 4 cancer population.
Advanced.
Correct.
So it's 3 and 4.
3 and
Stage
4.
3 and
Advanced.
4. That was
Okay.
the criteria. Being a woman, we were sorry to turn away men, but the parameter was that it had to be a woman with stage 3 or stage 4 diagnosis, and the age requirement was 18 and above.
Got it. Dr. Grill, the success of the recruitment, as you said, can be very difficult. The fact that you had so much interest and so much good press, how much of that was right study at the right time? And how much of it, I think part of the success stems from your unique collaboration. You've got your clinical experience, and Saranne brings this marketing and PR and communications experience, and just a different side of the healthcare landscape. So I know it's a bit of both, but where do you think the two play together?
Yeah, absolutely. I mean, I think with ComedyCures, who, they were the ones doing the recruiting, and Saranne, correct me if I'm wrong, I think it was about maybe 2 weeks for us to fill out the study. We were looking for 50 women to participate. And, in research projects that I've done, sometimes this can take years. So I just know, I mean, it's not an exaggeration. It really just takes a long time. So I think that, having them do the press releases, do the marketing, already have this wide network of people who follow ComedyCures, who are in this patient population, that made things a whole lot easier for us, and able to kind of do this study in a short timeline and start to get some of that information out there to other folks who are just curious about the findings. And I think another thing that was really important is the digital nature of this. And I know this is all of what Startup Health is about, but innovating within healthcare to make things easier. And when I was doing NIH research, everything was in person, like completely in person. And we would be asking these folks who were really sick to come into the hospital and come in multiple times, because you'd have, multiple study visits. And that's just traditionally how healthcare is done. But because of this study, as Saranne mentioned, we have women from all across the world who are able to participate in this, because it's really as simple as, using some data collection forms to get that information about how things are progressing over time, and then being able to use our platform and our app, which they can use, from anywhere. They just need to have access to technology. So I think it's that combination of things. Using this technology to increase access to care is really what we're seeing that's going to be so important to health. And in a couple of years, I don't think it's going to be digital health anymore. It's just modern health, right? Somebody said that to me yesterday, and it really just clicked with me. I was like, yes, that's exactly what it is. It's not digital. It's just modern health. It's the future. And then really having, ComedyCures and their expertise around, working with women who are living with advanced cancer.
I also think that anytime you infuse comedy into something that people are interested, I think it's a shiny thing that people are really curious about. And you don't think of a advanced stage cancer patient as laughing and finding things funny. So just that juxtaposition of technology, you don't necessarily think technology is funny or neuroscience is funny, and then you have all of a sudden you smash it together with ComedyCures content, ComedyCures programming, and I think it just becomes really interesting bedfellow, so to speak. So I think that was the appeal. We wrote the press release that I put out started with intrigue, because we were intrigued. So I made the headline of it intriguing, and then I started the whole press release with a joke. So who does that in deep scientific research?
I gotta ask, what joke do you begin a press release with? Do you recall which joke it was?
Yeah, it was a neuroscientist, a psychologist, and a cancer survivor walk into a bar. Basically like, that classic play on that joke.
Got it.
So, I mean, how do you not? Because you were putting the three of us together.
I love
and
it.
we wouldn't, we wouldn't likely be doing this. So I wrote that it sounds like the classic joke. And then I started it with the joke and said, but it's not a joke. We're actually we're looking to explore how this can help women living with advanced cancer. And so I think that intrigued a lot of people because it's not your typical tech story or typical healthcare story or typical science story. And just in terms of the people, like we only needed 8 to 10 women for this study. We decided to go with 50. Like we put that big number on there. We only need 8 to 10. So when we went above the 50, and we were just like, wow, we only really need 8 to 10, but how do you say no to people, that are living with advanced cancer? So we decided to expand the study. And, what's really heartbreaking is because I'm in touch with the patients very often, is that we have had people pass away. And one of the most shocking things, as Katherine said, was usually studies take a very long time to get up and running. And we were like, boom, we hit the ground running with this thing. Yeah. And there were actually people who passed away between when they took the eligibility study and when we opened up the first day of the study. And it was such a short window of time. And from an emotional point of view, just having been in that situation as a stage 4 patient, I have to tell you, the honor that I felt and the pride of that women who were that ill would take the time to fill out our eligibility study, and be excited about being part of something this groundbreaking the week of their passing. I mean, the whole thing just still chokes me up a lot.
Yeah.
It's pretty amazing.
The uniqueness of this process is really the story here to me, just in terms of, the way that you came together, the way that you reached out to folks, the speed at which you worked. And I think it's just a picture of this greater lesson for entrepreneurs to be open to what really needs to happen in order for them to get over the goal line. What kind of collaborations need to happen, kind of, looking beyond what you think is your prescribed path, you know what I mean? And think, what do I really need to pull together?
But I also think listening, because I had much bigger visions of what this would be. We're going to go and review journals. And Katherine was just like, rein it in, girl, right? Because I think very, very big. And she's just like, rein it in. Like this takes a lot of energy and a lot of focus, and you just have to start small and then grow. So that was that I could listen to her and respect her expertise and pull it back. And, we have learned so much from this. I mean, I don't want to put words in your mouth, but I have learned so much from the collaboration. And I just thank Startup Health because you make it easy at your conference to really just network and get to know and explore and expand. I mean, I'm in touch with a lot of people from that conference, and it's just been so much fun watching all your founders evolve, and one of your speakers became First Lady.
That's right.
And the other one the year before became president.
That's right. That's a good tee up for a quick final question, which is, obviously this collaboration was successful. You're able to do this feasibility study and we're having this conversation. So a question is, what is next for the ComedyCures Neolth union, and what are you going to build next? Dr. Grill, maybe you can go first.
Yeah, I think I'll first preface that by saying to any, entrepreneurs or doctors or anyone out there who's interested in this type of collaboration, first off, festivals like Startup Health are fantastic. I mean, that's how you meet other people. So definitely participate, virtually or in person when we get back to that. But also thinking about, how do you define success? As Saranne was mentioning, wanting to do this big project and hoping for all these outcomes. And you really need to take a very incremental approach to these projects because, for example, when we've been working with our youth, I mean, we've worked with nearly 300 so far, and we've had hours and hours of focus groups, and I think over 40 focus groups in the past specific project. So this collaboration is really just the first step of that, getting feedback from the first group of 50 people and really understanding, okay, this in a digital product is working for these people. This is not working for these people. How would we tailor it? Because I think we've seen in the conversation around healthcare and mental health care in particular, this push towards personalization and really trying to understand how different people, whether it's from a different community, people with a different diagnosis, et cetera, how they're interacting with these innovative products. So I think that this is really just the first step into understanding how digital health can be used in this population.
Saranne, what do you say? What's next?
So we still have to analyze all the data, but just from the interviews that I've been doing, what I found really interesting was the women saying that just getting the reminders from the Neolth platform made them realize how much they didn't focus on self-care. And that maybe they didn't feel well enough on a certain day to actually go into the platform, but just the fact that they were part of this and the reminders to take care of themselves, these general reminders that the platform sends out, made them realize that they needed to focus more on their self-care plans and on themselves. And another one of the women in the study said that the comedy part of it, the part that ComedyCures brought to the table, it made her realize that she just has to have a lot more fun in her life, and that she was spending every day just so trying to survive against the odds that she wasn't living her life. So that changed the entire way that she schedules her days and weeks. And she doesn't know how much time she has, but it just made her live life in a very different way. So we know that we have had impact on the women. I think that, the grant that we got was small, and it also is just for preliminary research. I think what I'm excited is when we report the findings, that the whole reason for the Willow Foundation grant is that we do a pilot study and then we report that to the world, and hopefully bigger organizations with much bigger budgets will pick it up and want to go further. They want to do a second study that will, course correct some of the things that maybe we didn't anticipate. If I had to do it again, I probably would have limited it to English speaking and one time zone, just because it added a layer in the live events that we did.
Sure.
That didn't, Catherine's 24/7, that didn't matter to her. But from my organization that was managing it and doing all the touch points with the women, we had challenges that we had to do to be able to service everybody equally. So I just think it's the tip of the iceberg. I hope that many organizations reach out to Katherine from many populations that realize that this is a perfect platform to do a study with, and they're a great team to work with.
I will make sure that contact information is in the description for this video. Saranne, Dr. Grill, I love the work that you're doing. I'm so happy that the two of you met at the Startup Health Festival and that you were open enough to meet, have lunch, and plant the seeds for a future collaboration, and that this feasibility study came about. Thank you for being the people that you are and doing the work that you're doing. And I really hope that this just is the beginning of something even bigger and more amazing.
Thank you.
Thanks
so much, Logan, and thanks to the Startup Health team for making this all possible.
All right. Thanks for coming on today. Hope you all have an awesome week, and be well. A quick word about this show, in case you're new around here. At Startup Health, we believe in broadcasting the stories of health moonshot progress, the stories of the most forward-thinking entrepreneurs in health. If you want more of this good news about healthcare's problem solvers, make sure that you subscribe to our channel, hit that notification button, and follow us on social media at Startup Health.